What you eat, family history, and getting screened can all play into preventing colon cancer, which is the second leading cancer killer in both men and women. Well, the doctors at SLUCare want everyone to know that colon cancer is treatable if caught early. That's the key right there. And here to talk about getting screened is SLUCare gastroenterologist, Dr. Charlene Prather. Good morning to you. We got you hooked up. Are you ready, Doc?
Good morning. I sure hope so.
Excellent. Yeah. Sometimes it's like surgery. Say, I was hearing that everybody needs to start getting checked for colon cancer at age 45, unless, of course, there is family history, correct?
That's exactly right. The recommendations have changed in the past couple of years. Previously, we remembered the age of 50, but now it's moving down to the age of 45 for most individuals. This is particularly important for African Americans who should definitely start their screening at age 45. Now, should you have a family history, a first-degree relative, multiple second-degree relatives, you might need to get screened a little bit early, and it's worth checking with your doctor about that.
And then normally it's 10 years after that, unless they find something during, for example, that first colonoscopy.
That's exactly right. One of the amazing things about colonoscopy is that it's not just a colon cancer detection test, but a prevention test. So when we do a colonoscopy and we see polyps, we remove those polyps. Those polyps can be precancerous and over many years lead to colon cancer. If we remove them, we remove that risk for colon cancer, or at least greatly reduce it. Now, if no polyps, or only one or two small polyps are found, a repeat in 10 years may be appropriate. Should we find polyps, that puts you at a bit of a greater risk, so we might bring you back as early as a year, 3 years, most commonly sometime around 7 years, if it's just one or two small polyps.
Doctor, what if during that 10-year period you have some kind of other cancer?
Yes, your family history of cancer may change that screening interval. Certain cancers, such as uterine cancer, bladder cancer, may put you at increased risk for colon cancer as well, having those in either yourself or in your family members. So screening isn't necessarily a one and done. It's worth redressing that with your family physician, your internist, every year to make sure you are up to date on the proper colon cancer screening and other screening tests that need to be done.
Yeah, and there's so much more, right down to processed foods, what you eat throughout your life. All of that can lead to little pockets in your intestines as well, which can create diverticulitis later in life. There's so much to know, and we have more information. We can link you up to a screening site as well as a website at fox2now.com, also on the Fox 2 mobile app. Dr. Prather, thank you so much for joining us.
My pleasure. Thanks so much.
Get
screened.